Welcome back. The time on the clock is 8:18, and we're taking a look at your health news this morning. January, it's typically the peak month for mountain cedar pollen here in North Texas, and with spring arriving, seasonal allergies will be peaking as well. Joining us right now is Teladoc Health physician Dr. Leah Joseph to talk about relief this season. Good morning to you, Dr. Joseph.
Good morning, Cleo.
All right, so tell us a little bit about seasonal allergies right here in North Texas.
Well, millions of Americans suffer with seasonal allergies, including myself, but we're seeing that the warm winter, the warm weather, especially in Dallas, is causing plants to pollinate earlier. So we're seeing higher pollen counts, and then the wet weather is causing the plants to grow faster. So we're seeing a surge in tree pollens, particularly the oak pollen, earlier in the season. And also there are grass pollens, weed pollens like ragweed, and we're also seeing mold spores surging right now. And those that are susceptible to these allergens are getting their allergies.
Yeah, they're certainly acting up for people right now. What can those who struggle with allergies do to prepare themselves this season?
First of all, I recommend knowing what you're allergic to by partnering with someone like myself, a primary care doctor, and we can arrange testing for you to know what you're allergic to. Then, if we can, reduce exposure, looking at the weather, for example, what the pollen counts are going to be in particular days, and adjusting your activities according to that. Windier days in particular can increase pollen counts and exposure. Simple things like taking your shoes off when you get into the house, taking a shower to wash off the extra pollen, that can reduce exposure too. But if you can't avoid the pollen, then I recommend prevention with over-the-counter medications such as antihistamines, steroid nasal sprays, and probably prescription medications.
Now, for people that are new to North Texas, they may have never had allergies and then they get here and they're like, what is going on? How do you actually know that you're struggling with allergies?
Well, someone may get typical symptoms for the first time, the congestion, runny nose. Some people get an irritating cough that just doesn't seem to go away. And in that case, you should check your doctor, your primary care doctor, to figure out what's happening.
Besides medications, what other things can people do with allergies, I guess, to manage their symptoms?
Besides medications, we
Yeah.
can think about supplements, simple things from the diet, including vitamin D that we can get in kale, spinach, fatty foods, fatty fishes, sorry, and zinc. Zinc we can get in nuts and legumes. That can help balance the immune system and reduce inflammation. And then there are probiotics that helps also with balancing our immune system. And we can get those in sauerkraut or yogurt, for example.
Good reminders there. Dr. Joseph, now you work with Teladoc, which provides virtual health services here in North Texas. Very convenient for people that may be struggling with allergies that needs a little help. How can people reach out to you? Tell us more about that.
Well, Teladoc is a large virtual health company, and we offer a wide range of services. We like to look at the whole person, and we can offer preventive services, including nutrition, weight management, and then treatment services for chronic conditions such as allergies or diabetes, hypertension, any of those chronic conditions. So you can find out more by going to www.teladochealth.com.
Perfect. Dr. Joseph, thank you so much for joining us here on Daybreak.
Thank you for having me.
Of course.